The Nurturing Education and Skills Training Program is part of the Prevention and Early Intervention component of the Mental Health Services Act. The goal of this component is to help counties implement services that promote wellness, foster health, and prevent the suffering that can result from untreated mental illness. The PEI component requires collaboration with consumers and family members in the development of PEI projects and programs. MHSA General Standards. Community collaboration. The NEST regularly engages with community partners to share information, resources, and services for TAY youth and their families, such as sexual health and reproduction education, sexual assault and intimate partner violence crisis services and education, Windows Between Worlds healing art groups, parenting classes and support groups, medically related transportation assistance, financial literacy, as well as connections to eligibility benefits and services like Supplemental Nutrition Assistance Program, WIC, Medi-Cal enrollment, CalWorks, TANF, etc. The NEST is also proudly sponsored by the nonprofit organization Seroptimus International of Clear Lake, who hosts welcome home and baby showers, holiday parties, fundraisers, as well as facilitating the recruitment of donations for participants. Cultural competency. Policy prohibits unlawful discrimination based on race, color, creed, gender, religion, marital status, registered domestic partner status, age, national origin or ancestry, physical or mental disability, medical condition including genetic characteristics, sexual orientation, or any other consideration made unlawful by federal, state, or local laws. All such discrimination is unlawful. RCS is committed to providing equal access to services. Services provided by RCS Incorporated and the NEST are designed to effectively engage and retain individuals of diverse ethnic, racial, cultural, and linguistic populations, as well as utilizing the strengths and forms of healing that are unique to the individual, the family, and/or their culture and community. Client-driven. The NEST engages participants through an individualized and client-driven approach that emphasizes family involvement and building natural community-based supports. By connecting young families to natural supports and their community, we foster supportive living and the ability to identify resources to meet their needs in the future. We do this using an individualized approach that is centered around each specific family's needs and desires. With staff support, participants develop their own independent transitional living plans, which identifies personal and family goals. These plans are reviewed during child and family team meetings and updated as needed. Participants are assessed at intake of their knowledge of life skills to understand the level of support individuals and families may need in order to achieve independence and improve child and family well-being. Family-driven. The NEST programming is designed to meet the unique needs of the TAY population and their families by utilizing the Family Voice and Choice approach. Family and youth child perspectives are intentionally elicited and prioritized throughout their engagement in the program. Planning is grounded in family members' perspectives and recorded in their personalized independent transitional living plans. The NEST team strives to provide options and choices that reflects family values and preferences while promoting safety, stability, and permanency. NEST staff intentionally focus on meeting families where they are at using strength-based, person-centered approaches to motivate engagement while empowering youth and families to be the agent of change in their own lives. Wellness, recovery, and resilience focused. Programming and services at the NEST are designed to empower youth through building social connections, increasing education, reducing stigma and discrimination, by promoting accountability and increasing self-determination. A significant number of youths who enter into the program are basic skills deficient and have minimal knowledge of resources and services available to meet their needs. The NEST hosts a variety of formal workshops and informal support groups that build resiliency and promote wellness in a collaborative and social environment. Groups and workshops are facilitated in-house and within their community. All NEST youth are connected to the local peer support centers and partnering agencies that perform a variety of services to promote permanency, safety, and child and family well-being. NEST participants are also offered referrals to in-house and community-based behavioral health services upon their intake into the program and throughout their stay. Integrated service experiences for clients and their families. TAE and their children who participate in the NEST program are frequently concurrently enrolled in interagency and community-based programs. The NEST coordinates with county providers such as behavioral health, healthcare providers, housing programs, substance use programs, and other social service agencies to bridge any gaps between the services offered at the NEST which may impact their ability to achieve stability and permanency. Children at the NEST are enrolled in home visiting programs through Lake County Tribal Health and Lake Family Resource Centers, which are then connected to service providers such as Easter Seals for assessments and referrals to early education programs. Youth entering into the NEST are connected to social service agencies to ensure that they are receiving all benefits of which they are entitled. The Nurturing Education and Skills Training Program provides transitional housing for young 18 to 25-year-old pregnant or parenting families and their children for 15 months. During this time, families work with a 3-person team consisting of the program supervisor, home specialist, and a child development specialist in a youth-driven process to reduce risk factors and increase self-sufficiency. The overarching goal is to increase families' reliance on their self-identified natural support systems, provide housing that will give them the stability to begin working on their independent goals, and break the cycle of poverty for their children, thus providing long-term sustainable change that will impact consumers as well as the community for years to come. Program activities proceeded as planned with some minor challenges relating to the COVID-19 pandemic. Key activities included facilitation of child and family team meetings, facilitation of house meetings, resource connection, coordinated linkage services, direct parenting support via observational assessment and training programs, skill building such as money management and budgeting, and cooking classes, screening tools GAD-7 Anxiety Scale, PHQ-9 Depression Scale, and the Adult Needs and Strengths Assessment for any adult wherein mental health may be a concern. Therapeutic intervention as determined by medical necessity, evidence-based life skill programming, and residential and community-based intensive case management. The NEST is connected to and has a history of supporting young families from tribal and Latinx communities. RCS and the NEST have close relationships with Lake County Tribal Health Consortium and receives many referrals from their healthcare facilities. The NEST is also closely connected to the peer support centers like La Voz de la Esperanza and the Circle of Native Minds, whose services seek to target these underserved populations. RCS and the NEST work closely together with consumers to better understand their culture and support their engagement by honoring their traditions and cultural holidays and events. The NEST served a total of 17 individuals in fiscal year 2021. Of those 17 served, 9 were children 0 to 15 years of age, 7 were transitional age youth 16 to 25 years of age, and 1 was an adult 26 to 59 years of age. The NEST served a total of 17 individuals in fiscal year 2021. Of those 17 served, 3 were Native American, 12 were white, 2 had some other race, 2 identified their ethnicity as Hispanic or Latino, and 15 identified their ethnicities as not Hispanic. The NEST served a total of 17 individuals in fiscal year 2021. Of those 17 served, 9 identified as being born female, 8 identified as being born male, 2 did not report their birth gender, 9 reported identifying as female, 8 reported identifying as male, 2 did not report their gender identity, 7 reported being straight, 1 reported being bisexual, and 9 did not report their sexual orientation. The most significant challenges throughout the past fiscal year were the state-mandated shelter-in-place guidelines implemented in response to the COVID-19 pandemic, PG&E public safety power shutoff events, and a reduction in staffing due to medical conditions. While key activities were able to continue, staff was creative in meeting these needs during these difficult times. In collaboration with the local Youth Resource Center, the Harbor on Main, NEST participants were able to receive life skill training classes on site. NEST and Harbor staff adjusted right along with youth and adapted their cooking classes to utilize the resources they received from food banks and produce pantries. When the pandemic first reached Lake County, the NEST, along with other residential programs and shelters, were advised not to adjust the population of their programs unless the benefit greatly outweighed the risk to the other clients. This meant that we may not have been able to meet our anticipated number for clients served in this year. This also impacted another family who would have completed the program in the midst of this pandemic. In response to the potential undue hardship this may have caused the family and to protect them from being at risk for exposure, the NEST made a one-time exception to allow this family to remain in the program until the family had adequate support and resources to stay safe and healthy. No changes are foreseen to program activities in the upcoming fiscal year outside of the state-mandated requirements in place due to the COVID-19 pandemic. However, they remain hopeful that they will be able to attend more face-to-face trainings and classes within the community, such as Motherwise and Nurturing Families, which had been postponed or closed to in-person services. The NEST anticipates serving approximately 8 families or at least 16 individuals throughout the next fiscal year. Because the NEST is a 15-month program, it is possible that they would not see a high turnover in a single year. Some participants enter into the program pregnant, and some enter in during the reunification process with child welfare. Depending on their length of stay, unique situation, and family size, numbers of participants can vary greatly from year to year. NEST consumers participate in monthly satisfaction surveys to assess the following: the number of parent participants who report an increase in well-being, the number of parents who report having the knowledge and skills to provide a safe, stable home for their children, the number of youth on probation who recidivate, the number of participants who leave the program with stable, long-term housing. These indicators are evaluated on a monthly basis as well as at the beginning and end of participation in the NEST program. The number of parent participants who reported an increase in well-being is 84%. The number of parents who reported having the knowledge and skills to provide safe, stable homes for their children was 74%. The number of youth on probation who recidivate was 0%. And the number of participants who leave the program with stable long-term housing was 90%.